Welcome back to Myths, Legends, and Truths. When you think of a physician, you would think they are highly skilled, knowledgeable, and compassionate healthcare professionals who are dedicated to the well-being of their patients. They play a crucial role in diagnosing and treating illnesses, managing chronic conditions, and promoting the best care possible for their patients. But it is not what some patients got when they went to Dr. Harold Shipman, aka Dr. Death. Harold Shipman, also known as Dr. Death, was a British doctor and serial killer. He was born on January 14, 1946, in Nottingham, England. Shipman worked as a general practitioner in Hyde, Greater Manchester, and it is estimated that he killed at least 218 of his patients, although the actual number may be higher. Shipman's crimes took place over a period of many years, starting in the 1970s and continued until his arrest in 1998. He would administer lethal doses of drugs, particularly diamorphine, a powerful opioid, to his victims, often disguising their deaths as natural or accidental. His victims were mostly elderly women, although there were also male and female patients of various ages among his victims. Shipman's actions went unnoticed for a long time due to his position as a trusted doctor and the lack of suspicion surrounding his activities. However, an investigation was launched in 1998 after concerns were raised about the high number of deaths in his practice. The investigation eventually led to his arrest, and he was found guilty in January 2000 of 15 counts of murder. He was sentenced to life imprisonment. In the subsequent inquiry, it was revealed that Shipman had likely killed many more patients than the 15 for which he was convicted. The final death toll attributed to him is estimated to be over 200, making him one of the most prolific serial killers in modern history. Harold Shipman committed suicide in his prison cell on January 13, 2004, one day before his 58th birthday. His case led to significant changes in the regulations and oversight of medical professionals in the United Kingdom to prevent similar incidents from occurring in the future. Harold Shipman, younger years. Harold Frederick Shipman was born on January 14, 1946, in Nottingham, England. To Harold Frederick Shipman Sr. and Vera Britton, he was raised in the town of Bestwood, near Nottingham, along with his 3 siblings. Shipman showed academic promise from an early age and attended the Queen Elizabeth Grammar School in Wakefield, West Yorkshire. He excelled academically and developed an interest in medicine during his school years. After completing his education at the grammar school, Shipman pursued a medical career and enrolled at Leeds School of Medicine in 1965. During his time at medical school, Shipman displayed a passion for pathology and anatomy. He obtained his medical degree in 1970 and began his career as a junior doctor at Pontefract General Infirmary in West Yorkshire. Shipman later trained as a general practitioner and obtained his diploma in general practice in 1974. In 1974, Shipman married Primrose May Oxtoby, and they had 4 children together. Shipman's professional career seemed to be successful. He appeared to be a caring and dedicated doctor to his patients. However, his hidden dark side would soon emerge. It wasn't until many years later that the extent of Shipman's crimes would be uncovered, revealing a chilling pattern of murder and deception. His motives remained unclear, although financial gain and a desire for control and power have been suggested as possible factors. The details of Harold Shipman's earlier years and personal life have been largely overshadowed by the notoriety of his crimes. The focus of public attention and scrutiny has primarily been on his actions as a serial killer and the subsequent investigation and trial. Harold Shipman, reasons for killing. The exact motives behind Harold Shipman's killings remain a subject of speculation and debate. Shipman himself never provided a clear explanation for his actions, and the true motivations behind his crimes may never be fully understood. However, several theories have been proposed based on the available evidence and psychological analysis. Number 1. Power and control. Some experts believe that Shipman's desire for power and control played a significant role in his killings. As a doctor, he held a position of authority and trust, which he may have exploited to exert control over the lives and deaths of his patients. Number 2. Medical euphoria. Shipman had a fascination with death and may have derived a sense of euphoria or satisfaction from exerting control over life and death through his medical interventions. Administering lethal doses of drugs to his victims could have given him a sense of power and fulfillment. Number 3. Financial motive. Shipman was known to have manipulated the wills and financial affairs of his victims, often forging documents to benefit himself. Financial gain may have been a motivating factor in some of his killings, so he sought to inherit his patients' wealth or deceive their families for personal gain. Number 4. Pathological personality. Shipman exhibited signs of a pathological personality characterized by a lack of empathy, a sense of superiority, and disregard for the rights and lives of others. It is possible that a combination of psychological factors contributed to his actions, including a deep-seated need for control, a lack of remorse, and a distorted perception of his victims as objects rather than individuals. While these theories provide some insight into potential motivations, it is important to note that the mind of a serial killer can be complex and multifaceted. The true underlying reasons for Shipman's actions may never be fully comprehended. Harold Shipman's legacy. Harold Shipman's legacy is primarily one of infamy and shock due to the extent of his crimes and the betrayal of trust associated with them. His case had significant repercussions on the healthcare system and the regulation of medical professionals in the United Kingdom. Here are some aspects of his legacy. Number 1. Impact on the healthcare regulation. The Shipman case exposed gaps in the system that allowed Shipman to evade detection for years. As a result, significant changes were implemented to improve patient safety and increase oversight of doctors in the UK. These changes included the introduction of rigorous checks and balances, closer monitoring of prescribing practices, and the establishment of systems to identify suspicious deaths. Number 2. Loss of trust. Shipman's actions eroded public trust in the medical profession, as he used his position of authority and trust to carry out his crimes. Many patients and their families were left questioning the motives and actions of their doctors, leading to a loss of faith in healthcare providers. Efforts have since then been made to rebuild trust and emphasize transparency and accountability in healthcare. Number 3. Impact on end-of-life care. Shipman's case raised important ethical questions about end-of-life care and the balance between pain management and euthanization. It prompted discussions about the appropriate use of powerful drugs and patient autonomy, and the responsibility of doctors in making end-of-life decisions. Number 4. Influence on forensic medicine. The Shipman case highlighted the crucial role of forensic medicine and pathology in uncovering evidence of foul play. It led to advancements in forensic techniques such as improved methods for detecting drug toxicity and post-mortem examinations. Number 5. Lessons for criminal justice. Shipman's case exposed weaknesses in the criminal justice system, particularly in handling complex investigations involving medical professionals. The subsequent inquiry into his crimes and the changes made in the legal system aimed to prevent similar cases from occurring and improve the handling of similar investigations in the future. Overall, Harold Shipman's legacy is a reminder of the potential for abuse of power and the need for strong systems of oversight and accountability within the healthcare profession. His case serves as a cautionary tale and has spurred significant reforms to prevent such atrocities from happening again.